Hello everyone, I am Martie Weege. I am a pediatrician at Queen Nandi Regional Hospital, and today I am going to do the session on ETAT of cardiopulmonary arrest in children. So this will form part of Module 3B, and this will mostly help us to identify the patient that is in cardiopulmonary arrest and where cardiopulmonary resuscitation needs to be started. So what is cardiopulmonary arrest and how do I identify a patient in it? So this is when a child has stopped breathing and their heart has stopped beating. It can sometimes also be a patient that's got inadequate breathing. Remember, gasping is not normal breathing, and we identify a patient in cardiopulmonary arrest when they are gasping or when they have stopped breathing. And this can also be when a heart rate in a child is less than 60 with inadequate circulation or when the heart is stopped completely. This often happens because of a delay in recognizing and treating those seriously ill patients. And that's why with ETAT, we try to demonstrate those priority signs of when we need to identify a patient in trouble so that we can avoid having a patient in cardiopulmonary arrest when we start treatment adequately and timeously. So when a patient has a delay in presentation to us, or if we have a delay in recognizing how very sick they are, this will lead to cardiopulmonary arrest. So doing cardiopulmonary resuscitation is a life-saving procedure that needs to be started as soon as possible when you identify the patient in need of it. This is then the provision of rescue breathing and chest compression to help deliver oxygenated blood to the body. This is called cardiopulmonary resuscitation, and this is what we are going to teach you during this session. By the end of this module, you will be able to understand the causes of cardiopulmonary arrest, to identify the clinical signs of when someone is in cardiopulmonary arrest, and how to manage the situation when someone has gone into cardiopulmonary arrest. During the assessment and treatment of a patient in cardiopulmonary arrest, we keep to our system airway, breathing, circulation. This often happens simultaneously when a patient is in cardiopulmonary arrest, but we need to first of all look at airway patency, make sure that our patient is breathing or that we start breathing for our patient, and then we identify the patient that is in need of CPR when we assess for circulation. If our patient has inadequate circulation, this is an emergency sign. When our patient needs CPR, this needs to be started as soon as possible. What can potentially be the causes for cardiopulmonary arrest? And we know in children, hypoxia is often the most common reason that leads to cardiopulmonary arrest. The causes in children are often airway obstruction that leads to hypoxia, severe lung disease, those little ones with pneumonias, bronchiolitis, shock, so patients with poor oxygen delivery because of hypovolemic shock, septic shock, hemorrhagic shock, patients with head injury, and this often includes patients with seizures or patients in status epilepticus who can't protect their airway adequately and has neurological compromise that causes respiratory arrest. Poisoning and drowning. These are the common causes in children that will lead to cardiopulmonary arrest. So how do I assess the patients that we need to start cardiopulmonary resuscitation on? So first of all, if you go systematic, airway, breathing, circulation, you will identify the patient that is not breathing or gasping. When you go over to assessing circulation, the patient will not have a pulse, or if you can feel a pulse, but it's a poor pulse or it's less than 60 per minute, and if there is no signs of life. When those three signs are present, you must start resuscitation immediately. Part of this resuscitation, you always call for help. Make sure you go airway, open that airway, do open airway maneuvers, you give 5 rescue breaths, and then you commence compressions, cardiac compressions. If you are only one rescuer, which will hopefully not happen frequently, you're going to do a ratio of 30 compressions and 2 breaths. If you are 2 rescuers, you will do 15 compressions to 2 breaths. If you do have an automated external defibrillator available, you will then at that point connect it. So let's just run through this algorithm again. When you have a patient that's in cardiopulmonary arrest, safety remains the main priority. Make sure you approach with care and that it's free from any danger to yourself. This also means that you want to make sure you've got gloves on and that you look after your own safety. When you get to the patient, you want to stimulate and say, "Hello, are you awake?" Call the patient by their name if their name is known to you, and do some stimulation to see if there's any response. Shout for help, and this is most important. If you are going to remain a lone rescuer or a single rescuer, the chances that you are going to be successful in this resuscitation efforts are very minimal. You need help. Now you follow your ABC approach. First of all, airway. Open your airway. Do basic open airway maneuvers. Once you know your airway is patent, you're going to assess breathing by doing a look, listen, and feel. Look if the chest is moving. Listen if you can hear any breath sounds, and feel if you can feel any air moving against your ear. If there is no spontaneous breaths, or even there's only inadequate breaths, which is gasping breaths, you will start doing 5 rescue breaths. And check while you're doing your 5 rescue breaths whether there's any signs of life. This is moving, coughing, crying. If none of that is present, you're going to start compressions. Again, if you are one rescuer, you will do 30 compressions to 2 breaths. If you are 2 rescuers, which will hopefully be the case, you will do 15 compressions and 2 breaths. If you do have an AED available, which is an automated external defibrillator, you will attach that and analyze your rhythm. If you are able to use and trained to use your AED, you will basically follow the commands from your AED machine. If there's a shockable rhythm, you will administer a shock, but in between, resume with your CPR immediately. The most important thing about CPR is to make sure that you reassess every 2 minutes. Your AED will analyze the rhythm and advise you on any further action. If it's a non-shockable rhythm, you are going to resume your CPR and check for signs of life every 2 minutes. Let's recap this. So in terms of our assessment and treatment of cardiopulmonary arrest, you want to always think about your SSS first, your 3 S's. Stimulate, safety, and shout for help. Once you assess your patient, you want to go in a ABC fashion, so airway, breathing, and circulation. And this often happens simultaneously. So Airway, we want to quickly open up the airway, the mouth, look and remove. If you can see any secretions or foreign bodies, you want to remove that. Open up the airway with basic airway maneuvers, a head tilt, chin lift, or a jaw thrust. Breathing, look, listen, and feel. For this, you often need to make sure you lift up the shirt so that you can, or get rid of the shirt, open up the shirt so that you can have a look at the chest. See if there is no respiration, you're going to start bag mask ventilation with an appropriate size mask and an appropriate ambu bag. Circulation, if there's no pulse or a slow pulse or poor circulation, and this is often just assessed by if there's no signs of life, no coughing, no spontaneous breathing, no crying, no movement, you will have to start CPR as soon as possible. So what about the chest compressions? So chest compressions needs to be adequate, hard and fast for it to work and for it to bring enough oxygenated blood to the brain and the other vital organs. So if you are doing chest compressions on an infant, you're going to place your 2 fingers in the midline just below the nipple line. And this is for if you are one rescuer. Depress the chest about 1/3 of depth of the chest in. This is deep and it needs to happen fast. You need to allow that chest to fully recoil. Otherwise, the heart can't fill properly and your venous drainage back into your heart is going to be compromised and your CPR will not be effective. When you are one rescuer, you're going to do these compressions at a ratio of 30 compressions to 2 breaths. When you are 2 rescuers, you can use the hand encircling technique, which is often much friendlier on your fingers, where you place your thumbs in the midline over the lower aspect of the sternum. You're going to use your thumbs to depress the chest. Again, you need to depress the chest 1/3 in and it needs to recoil fully. If your fingers are not getting tired after each 2 minutes, you are not doing it deep enough. These compressions need to happen 100 to 120 compressions per minute. This is fast and it's deep. And you need to ensure that your fingers and your fully recoil after you compress deep. We often say that if you think about how fast your compressions is doing CPR, you often need to think about the song Staying Alive. So it means compressions happen in a fashion of staying alive, staying alive. That is how fast the compressions need to happen for it to be effective and efficient. When you are doing chest compressions on a child and you are a single rescuer, you place your heel of your hand over the lower third of the sternum. Depress the chest about 1/3 to half the depth of the chest and allow the chest again to fully recoil in order to fill the heart, to suck in blood into the heart. If you are a single rescuer, you're going to do this 30 compressions to 2 breaths. Hopefully, you'll be 2 rescuers where you can do this in a 15 to 2 ratio. If you have 2 rescuers, again, you place your heel of your hand over the lower third sternum and depress the chest about 1/3 depth into the chest. Again, this happens at 100 to 120 compressions per minute. It's fast and it's deep and it's hard. And your hands must get tired, otherwise you're not doing it correctly. So during CPR, how do I reassess my patient? Every 2 minutes, you need to reassess for breathing and signs of life. You can also feel for a pulse, but the most important thing, if there's no signs of life, don't delay, restart your CPR. You need to continue compressions until there are signs of life or a palpable pulse. Continue your bag mask ventilation until the patient has actually got sustainable breathing. If the sustainable breathing is achieved, you can then place the patient into a recovery position and remember to still give them some face mask oxygen. If after 2-minute cycles there is still no breathing, signs of life, or a palpable pulse, continue with CPR. Remember that if you do have those AEDs available and you are trained to use them, then you need to start attaching them. Continue in this 2-cycle manner until the patient improves. If there is no improvement, consider stopping the resuscitation after 20 minutes. And this is commonly practiced, although there's not a lot of reference for it, but after 20 minutes of sustained hypoxia, the prognosis is unfortunately guarded for that patient to have a normal neurological outcome. So what about adrenaline? If you are trained to use adrenaline, you can use adrenaline every 4 minutes on a patient doing CPR. If you are not trained to use adrenaline, then you rather need to call for senior help before you just give doses that you are unsure about. So let's recap our algorithm. We're going to look at our SSS, safety, stimulate, and shout for help. We're going to do our ABCs. A, open airway. B, assess for breathing. Look, listen, and feel. And if there's no breathing, we want to give 5 rescue breaths. And while we give those 5 rescue breaths, we check for any signs of life, which is coughing, crying, spontaneous movements. If none of that is present, I want to start compressions. If I'm a 1 rescuer, I'm going to do 30 compressions and 2 breaths. 2 rescuers, 15 compressions and 2 breaths. At any point when you have your AED, you must attach that, especially after 2 minutes of CPR that you've started. You can then see if the AED analyzes a rhythm for you. It will then prompt you, if it is a shockable rhythm, to administer a shock and then resume CPR immediately after the shock was delivered. Still check for signs of life every 2 minutes. If you've got a non-shockable rhythm, you continue with CPR and check for signs of life every 2 minutes. Just as a summary, when we assess our patient with cardiopulmonary arrest, you need to identify the patient that is needing CPR as a child that is not breathing and has a poor pulse, poor circulation, which means a heart rate of less than 60, and a patient that has got no signs of life. The difference between a single rescuer and having 2 or more rescuers when you start CPR. As a single rescuer, you're going to give compressions, 30 compressions to 2 breaths. As 2 or more rescuers, you're going to give compressions 15 to 2. For the rest, it remains the same. Always do your SSS, safe environment, shout for help. Go through your airway breathing circulation, so open airway, commence ventilation with your self-inflating bag and mask. Do your compressions in the correct ratio, 30 to 2 for a single rescuer, 15 to 2 for 2 or more rescuers. Reassess after 2 minutes. Make sure you attach your AED if that is available. Call for senior help, and if you are trained to do so, you're going to use your AED. You continue your CPR until your patient improves, or consider stopping after 20 minutes. It's important to identify someone that can keep time for you, as it's quite difficult during CPR to carry on with your CPR, do airway breathing, look after your patient and still keep time. It is advised to have your cell phone next to you. That can often be quite valuable, to just make sure you set it for every 2 minutes, that there is an alarm going off after 2 minutes for you to reassess your patient. Remember to continue to reassess patients every 2 minutes. You can now continue with your assessment questions, which are on page 39 and 40 of your manual. Thank you very much.